You've seen the articles, right? The viral posts, the 5-minute quizzes with titles like 10 Signs You're Dating a Psychopath. They all talk about a chilling lack of empathy, a silver-tongued charm that feels just a little too perfect. You read them, and maybe a coworker comes to mind, or an ex. Maybe in a fleeting, uncomfortable moment, you even see a flicker of yourself. But what if those checklists are just scratching the surface? What if the actual instrument, the one used by forensic psychologists to assess convicted criminals, reveals a far more complex, calculated, and frankly unsettling picture? Today, we're not scratching the surface. We're looking at the official 20-item assessment that professionals use to get to the truth. We'll compare what everyone thinks they know about psychopathy with the gold standard used in the field. The goal here isn't to diagnose anyone through a screen. It's to give you a more sophisticated understanding, to show you the nuanced reality behind a word we all use, but very few truly comprehend. This is the difference between pop psychology and professional assessment. First, let's talk about the popular idea of a psychopath. If you were to build one based only on internet articles and crime thrillers, you'd probably end up with a very specific character. This person is almost always male, brilliant, and dripping with a smooth, predatory charm. They're the master manipulator, the emotionless killer, a caricature that's both terrifying and, thankfully, pretty rare. The most common traits you'll read about usually boil down to two big themes: a lack of empathy and a gift for deception. Let's start with lack of empathy. This is, without a doubt, a cornerstone of the condition. But the online version often simplifies it to an almost cartoonish degree. It's shown as a total inability to get what others are feeling. The idea of someone who just doesn't understand why you're crying after a tragedy, or who might literally yawn during a heartfelt confession. While that coldness is part of it, the reality is far more intricate. It's not always an obvious disregard for your emotions. Sometimes it's a stunningly accurate cognitive understanding of them, just without any of the feeling that should go with it. They can read your emotions like a book, not to sympathize, but to figure out how to manipulate you. It's a cold data gathering process. They know what makes you tick, what makes you happy, and what makes you hurt. They just don't feel any of it. It's like a colorblind person who has learned to name all the colors correctly, without ever actually seeing the color red. They know the word, they know the context, but the sensation is completely missing. The second trait that always makes the list is superficial charm. We're told to watch out for the person who is a little too smooth, too witty, too complimentary. They seem to have a magnetic personality and can hold a room's attention. The internet checklist warns that this charm is a mask, a tool used to disarm people. And this is true, but it's the quality of the charm that's often misunderstood. It's not always the slick, high-energy charisma of a movie villain. Often, it's a chameleon-like ability to be exactly who you want them to be. With a potential investor, they're a visionary genius. With a vulnerable person, they're a sympathetic, wounded soul. With a boss, they are the most dedicated employee you could ask for. This charm isn't a fixed personality trait, it's a performance. And like any good actor, they can play many parts. The superficiality comes from the fact that beneath the performance, there's no consistent self. It's a hollow core, surrounded by a series of expertly crafted masks. These online descriptions aren't totally wrong, but they're incomplete. They're two pieces of a much larger, more disturbing puzzle. They focus on the dramatic stuff, but they miss the subtle internal mechanics and the chronic, ingrained lifestyle patterns that a professional looks for. They give you the what, but not the why or the how, and that's where the real assessment tool comes in. All right, let's look behind the curtain. In the world of clinical and forensic psychology, assessing psychopathy isn't a casual quiz. It's a rigorous, evidence-based process. The main instrument used for this is the Hare Psychopathy Checklist Revised, or PCLR, developed by Dr. Robert Hare. It's considered the gold standard for assessing psychopathic traits. This isn't a self-report questionnaire. Someone can't just fill it out. It has to be administered by a highly trained clinician. The process involves a long, semi-structured interview, and just as important, a deep dive review of the person's entire life story, criminal records, work history, medical files, and even interviews with family and friends. It's an exhaustive investigation. The checklist has 20 items, and each one is scored on a 3-point scale: 0 if it doesn't apply, 1 if it kind of applies, and 2 if it's a definite match. While the PCLR is an assessment instrument, and not a formal diagnosis itself, a score of 30 out of 40 is a benchmark that in many legal and clinical contexts indicates a high level of psychopathy. What makes the PCLR so effective is that it splits these 20 traits into 2 main factors, which are sometimes broken down into 4 smaller facets. Factor 1 is interpersonal solifective. This group of traits describes the core personality, their emotional style, and how they relate to others. This is the selfish, callous, and remorseless use of other people. This is the part that most people find so bone-chilling. Factor 2 is the lifestyle antisocial factor. This group of traits describes how that core personality plays out in the real world through an unstable, irresponsible, and socially deviant life. Let's break down some of the key items from both. You'll see some overlap with what we've already talked about, but the clinical definitions are far more precise and damning. Factor 1. The core personality. This is where we go way beyond simple charm and lack of empathy. Item 1. Glibness, superficial charm. We've touched on this, but the clinical definition is more specific. It's not just about being likable. It's a smooth, engaging, and slick presentation that just doesn't match up with the reality of their life. Their stories are often entertaining, but will completely fall apart if you look too closely. They might tell you a grand story about a past business success, but a look at their records shows a string of bankruptcies and lawsuits. The charm is a polished veneer over a chaotic and destructive life. Item 2. Grandiose sense of self-worth. This is so much more than high self-esteem or arrogance. It's a deeply inflated view of their own abilities and importance, a belief that they are superior beings who don't have to play by the same rules as everyone else. This isn't just thinking you're the smartest person in the room. It's a core belief that you are fundamentally better, more deserving, and entitled to whatever you want. This trait is why they can seem so unfazed by the consequences of their actions. In their mind, society's rules are for other, lesser people. Item 4. Pathological lying. This is one of the most defining features. The lying isn't just occasional or strategic. It's everywhere, and often for no reason at all. They lie when it would be just as easy to tell the truth. They lie to impress, to manipulate, and sometimes it seems, just for the fun of tricking someone. The lies can be moderate, exaggerating a story to make themselves look good, or they can be extreme, creating entire fake identities and life stories. When a clinician scores this, they're not looking for a few white lies. They're looking for a life built on a foundation of untruths. Item 6. Lack of remorse or guilt. This is a profound inability to feel bad about the pain they cause. They might say they're sorry, and they can be very convincing, but it's a strategic move, not real emotion. They see the destruction they cause, ruining someone financially, emotionally, or physically, as the other person's fault. He shouldn't have been so naive, or she was just too emotional. They show a shocking disregard for the devastation they leave behind. A key indicator for a clinician is that when confronted, their main concern isn't for the victim, but for the consequences to themselves. Item 7. Shallow affect. This one is subtle and genuinely eerie. It refers to a very limited range and depth of emotion. They can put on big dramatic displays of anger, joy, or love, but these displays often feel short-lived and fake, like a bad actor on a stage. They can talk about intensely emotional events, a death in the family, a supposed betrayal, with a detached, almost academic coldness. You get the sense they're reporting on an emotion rather than experiencing it. They can't be moved or touched on a deep level, which makes any real connection with them impossible. Item 8. Callous, lack of empathy. This goes hand in hand with having no remorse. It's a cold disregard for the feelings, rights, and well-being of others. It shows up as selfishness, cynicism, and putting their own needs above all else. They see people not as human beings with their own lives and feelings, but as objects to be used and thrown away. This is the trait that allows them to be so predatory. Empathy is the brake that stops most of us from hurting others. In their case, that brake is just gone. Factor 2. How the personality plays out. If Factor 1 is the blueprint of the mind, Factor 2 is the chaotic building that gets built. These are the observable, real-world behaviors that define their lifestyle. Plenty of people can be selfish or arrogant, but it's the combination of Factor 1's personality with Factor 2's chronic instability that gives us the full picture. Item 3. Need for stimulation's proneness to boredom. People with high psychopathic traits feel a constant, gnawing need for novelty and excitement. They get bored easily. With jobs, with relationships, with life itself. This leads them to seek out thrills and take risks, not just for the adrenaline rush, but to escape a chronic feeling of inner emptiness. This is why they might suddenly quit a good job, end a serious relationship, or move to a new city on a whim. The stability most of us want feels like a prison to them. Item 9. Parasitic lifestyle. This describes a pattern of intentionally and selfishly living off other people. It can be financial, emotional, or both. They are masters of taking far more than they give. This could be the adult child who refuses to work and lives off their parents, the partner who drains their significant other's bank account, or the friend who's always in a crisis that only you can solve with your time and money. It's a calculated dependency, built on manipulation and a powerful sense of entitlement. Item 13. Lack of realistic, long-term goals. For all their grand talk, their actual life plan is often non-existent or completely unrealistic. They might talk about becoming a millionaire or a famous artist, but they have no real viable plan to get there. They live day to day, with very little thought for the future. They just drift through life, taking the path of least resistance, which is a huge contrast to the ambitious persona they often put on. Item 14. Impulsivity. This is the tendency to act on the spur of the moment, without thinking about what happens next. It's not just making a bad decision once in a while. It's a core part of their behavior. They'll make huge life choices, getting married, starting a business, committing a crime, with little to no forethought. This impulsivity, when combined with a lack of empathy, is an incredibly dangerous mix. It means they can do tremendous harm without hesitating for a second, because the impulse to act isn't slowed down by any concern for the outcome. Item 15. Irresponsibility. This trait is marked by a repeated failure to follow through on their obligations and commitments. They're unreliable employees, unfaithful partners, and neglectful parents. They don't pay their debts. They show up late or not at all, and they consistently let people down. This isn't because they're disorganized or forgetful. It's because they just do not care. The promises they make are meaningless to them. They're just words they use to get what they want right now. The critical caveat. This is not a DIY diagnostic tool. Okay, after hearing that list, your mind is probably racing. You might be fitting these descriptions to people you know, or maybe even worrying about some of them in yourself. That is exactly why we need to have a very serious conversation about what this information is for. Let me be crystal clear. The PCLR is a powerful clinical instrument that should only be used and interpreted by a qualified and experienced mental health professional. This video is for educational purposes only. It's designed to inform, not to diagnose. Trying to use this checklist to label your boss, your neighbor, or your ex is irresponsible, unethical, and potentially very harmful. A real assessment requires access to extensive records and a level of clinical training that you just can't get from watching a video. Many of these traits, by themselves and at a lower intensity, can be part of normal human behavior. Who hasn't been irresponsible at some point? Who hasn't told a lie? The difference is in the pattern, the severity, the pervasiveness, and how these traits combine over a person's entire life. A clinician is trained to see that full picture, to tell the difference between someone who is simply a jerk and someone with a profound personality disorder. Misusing this information can cause real harm, wrecking relationships and reputations based on an amateur guess. If you have genuine concerns about yourself or someone else, the only responsible thing to do is to seek a consultation with a trained mental health professional. So, the popular, internet-driven idea of a psychopath is a simple sketch of a much more detailed and complex portrait. The real picture, as painted by the PCLR, isn't just about a lack of empathy and charm. It's about a specific combination of interpersonal problems, emotional poverty, and a chronically unstable and antisocial lifestyle. The biggest difference between the online checklist and the professional tool is the difference between behavior and personality. The internet lists focus on what they do. They lie. They manipulate. The PCLR focuses on who they are, their shallow emotions, their grandiose self-concept, their parasitic nature, and how that core identity drives their behavior across their entire life. The goal today was to empower you with a more nuanced understanding, to move beyond the movie monster caricature and see the clinical reality. Knowledge is a powerful tool, not for labeling other people, but for recognizing patterns that can help you protect yourself from manipulation and exploitation. It gives you a framework for understanding a confusing and often painful type of human behavior. You are now better equipped to see past the superficial mask and recognize the deeper, more consistent patterns of a truly disordered personality. This is obviously a complex and heavy topic, and I'm sure it's brought up a lot for you. I'm genuinely curious to hear your reflections. What was the most surprising or eye-opening trait for you? Share your thoughts in the comments below. But please, let's keep the discussion respectful and avoid any armchair diagnosing. If this video gave you a new perspective, consider subscribing and hitting that notification bell for more deep dives into the psychology of human behavior. Thanks for watching.